So if you are currently taking one of these blood pressure medications, whether that is Losartan, Valsartan, Amlodipine, or Metoprolol, this video is for you, because there is a whole conversation around these medications that very rarely happens in a 10-minute GP appointment. Not because doctors are hiding anything from you, I want to be really clear about that, but because there genuinely is not enough time to cover everything you probably deserve to know. Things like what these medications are actually doing inside your body, why certain lifestyle factors interact with them in ways that matter, and what you can do alongside your medication to support your blood pressure management as effectively as possible. This is not about replacing your medication or going against your doctor's advice. It is about being a more informed patient. And in my experience, informed patients do better. I'm Dr. Alex, an emergency medicine doctor with nearly a decade working across the NHS. Blood pressure medications are some of the most commonly prescribed drugs in the world, and I see patients on these medications every single day. What I also see consistently is how little most people understand about what these drugs are doing, what to watch out for, and how their daily habits are either working with or against the medication they are taking. So let me walk you through what you genuinely need to know. Let's start with what these 4 medications actually are and why they work differently from each other, because they are not all doing the same thing. Losartan and Valsartan both belong to a class called ARBs, which stands for angiotensin receptor blockers. Without getting too technical, your body has a hormone system that regulates blood pressure, and one of its key players is a molecule called angiotensin II. This molecule causes your blood vessels to constrict and your body to retain sodium and water, both of which push blood pressure up. What Losartan and Valsartan do is block the receptors that angiotensin II binds to, essentially stopping it from doing its job. The result is that your blood vessels relax and your kidneys release more sodium and water, bringing blood pressure down. These medications are also particularly valued for their protective effect on the kidneys, which is why they are commonly prescribed in people with diabetes or early kidney disease alongside high blood pressure. Amlodipine works through an entirely different mechanism. It is a calcium channel blocker. The smooth muscle cells in your blood vessel walls need calcium to contract. Amlodipine blocks the channels that allow calcium into those cells, which means the muscle cannot contract as forcefully, the vessel walls relax, and blood pressure drops. It is also used for certain types of chest pain because it relaxes the coronary arteries as well. Metoprolol is a beta blocker. Your heart has receptors that respond to adrenaline and similar stress hormones, and when those receptors are activated, your heart beats faster and harder, which raises blood pressure. Metoprolol blocks those receptors, slowing the heart rate and reducing the force of each contraction. It is particularly useful for people whose high blood pressure comes alongside a fast heart rate, anxiety-driven spikes, or certain heart rhythm issues. Now here is where it gets really important, and this is the part most people are never told. Each of these medications has specific interactions with foods, drinks, and lifestyle factors that can either reduce how well they work or increase the risk of side effects. And these are not rare or obscure interactions. These are things that are genuinely relevant to daily life. If you are on amlodipine, grapefruit and grapefruit juice is something you need to be aware of. Grapefruit contains compounds that interfere with an enzyme in your gut responsible for breaking down many medications, including amlodipine. When that enzyme is blocked, more of the medication enters your bloodstream than intended, which can amplify its effects in ways that are not always predictable. This is worth discussing with your pharmacist or doctor if grapefruit is a regular part of your diet. If you are on Losartan or Valsartan, potassium is something to pay attention to. These medications can cause your body to retain potassium, which is usually a good thing because most people do not get enough. But if you are also taking potassium supplements or eating very large amounts of high-potassium foods like bananas, oranges, and potatoes all at once, it is worth being aware that potassium levels can rise. Very high potassium can affect heart rhythm, so if you are on an ARB and you are supplementing potassium separately, mention it to your doctor. Metoprolol is best taken with food because food slows its absorption and helps maintain more consistent levels in the bloodstream throughout the day. Taking it on an empty stomach can lead to less predictable absorption. Also, if you are on metoprolol, It is really important never to stop it suddenly without medical guidance. Beta blockers should always be tapered down gradually under supervision, because stopping abruptly can cause a rebound effect on heart rate and blood pressure. Now let's talk about lifestyle. And I want to be clear that everything I'm about to say is intended to complement your medication, not replace it. Please do not adjust or stop any prescribed medication based on a YouTube video. Always work with your doctor. That said, the research is really consistent on several lifestyle factors that work genuinely well alongside blood pressure medication. Sodium reduction is probably the most impactful single dietary change you can make. Most people consume significantly more sodium than they realize, not from the salt shaker, but from processed foods, bread, sauces, and ready meals. Reducing sodium intake has been shown in multiple studies to meaningfully support blood pressure management, and it makes your medication work more effectively because you are not constantly fighting against excess fluid retention. Regular physical activity, particularly walking and moderate aerobic exercise, supports the health of your blood vessel lining in ways that directly complement what these medications are trying to achieve. Exercise improves endothelial function, reduces arterial stiffness, and helps the body manage the hormonal systems that regulate blood pressure. Sleep is another factor that is massively underappreciated in blood pressure management. Poor sleep, particularly less than 6 hours a night, is independently associated with higher blood pressure. If you are taking medication but regularly sleeping badly, you are making your medication's job significantly harder. Alcohol is worth mentioning specifically because it interacts with blood pressure in a complicated way. Small amounts may have a mild relaxing effect on blood vessels, but regular or heavy alcohol consumption raises blood pressure over time and can interfere with how consistently your medication works. And finally, the most important thing I want you to take away from this video. These medications work. The research behind them is robust, and they genuinely protect your heart, your kidneys, and your brain over the long term. But medication works best as part of a broader approach that includes the lifestyle factors I just described. The goal for most people over time, in conversation with their doctor, is to support their blood pressure so effectively through lifestyle that their medication dose can potentially be reviewed. That is a conversation worth having with your GP. Not today necessarily, but as a long-term goal. Know what you are taking. Know why you are taking it, and be an active participant in your own health. That is what makes the real difference.